Hello again everybody. I wanted to talk to you today about lost fillings. In most cases it doesn't cause you any pain or any problems, so it's not really classed as a dental emergency. Obviously if it's giving you a lot of pain or you're not able to eat or the pain is keeping you awake at night, then obviously you do need to see your dentist as soon as possible. I just wanted to give you a few tips on what to do to try and keep it as healthy as possible until you can get to see your dentist. Now, when the filling comes out, you're left with a hole in your tooth. Now that hole can pick up lots of debris and food particles, so it's really important to try and keep that as clean as possible. So you can use your toothbrush, give it a brush with your toothbrush, rinse with some warm water to try and clean it out after every meal. That will work. However, if that is irritating that you have to keep doing that, you can get a temporary cement kit. This is only a temporary measure. This shouldn't be used for a long-term filling. It's just to tide you over until you're able to get to your dentist. So it should be treated that way. So what you need to do is get somewhere where you can see the tooth. It is much easier to do a lower tooth on yourself than an upper tooth. You may need help to do an upper tooth, but on a lower tooth, you're probably reasonably okay because you have quite good vision right to the back of your mouth. You get your little bottle of eugenol, so that's your first one, and as soon as you take the lid off, you'll recognise the smell because it smells like clove oil. So what you do is you put a little drop of that on there, and then you put that in the tooth that you are going to be filling. So you put your eugenol on there, take the second bottle, and inside there you will see that there is some white putty. So you take a little bit off and you roll that in your fingers, make a little ball, you put it in the tooth, and you use this little instrument just to make sure it's all pressed down. Now you only want to follow the contours of the tooth. You don't want to have a great big wad of it in, so do it in stages if necessary. Just put a little bit in and make sure that you've got the hole filled. What you need to do then is let it set. So you can bite down on your gauze so that you make sure that it's not too high on the bite. I should be biting on that first. Leave it a couple of minutes. It should set within that time, but don't eat or drink anything for a couple of hours afterwards, just to make sure it's completely set. Now that should tide you over. If it wears down or it falls out, you can mix a little bit more and pop it back in if it's still painful or it's getting a lot of food stuck in there, and that should help you out until you can see your dentist.